The swine flu. If you're a parent with kids in school, these words may be three of the scariest ones that you can think of. Today on Speak Up, we'll talk to three health professionals and find out how to handle the fear. We started bringing you stories regularly on swine flu just a few months ago, back in April. The initial stories involved illness and death of folks far away from the Gulf Coast. Today, though, just 4 months later, the concerns and fears are now here with us. Hello, everyone. I'm Eric Reynolds. Thanks for joining us today on Speak Up. The swine flu virus caused quite a scare back in 1976 when an Army recruit died after being infected at Fort Dix in New Jersey. Despite several other soldiers at the base becoming ill, it never became the pandemic that many had feared. So how does the 2009 breakout compare, and are our fears today justified? Joining us today to discuss this are Dr. Herbert Stone, along with Dr. Mike Bucknell and Makinde Gabolahan. Gentlemen, thank you all for joining us today on Speak Up.
Thank you.
Let's start first with what exactly is this swine flu that have so many of us now in fear and hysteria in many cases?
Well, the swine flu is not a seasonal flu, and I think that's probably the thing that's the scariest thing about the flu. You were talking about an outbreak in April, and here we are in August going into September, and we're talking about an epidemic, a pandemic, if you will, of this flu. It's called a novel flu, the novel flu, or the H1N1. And it primarily is called swine flu because of some similarities between the virus that causes this disease and genes in viruses that cause illnesses in North American pigs. So it's a novel flu, and probably one that most of us, and we'll talk about that a little bit later, most of us have not been exposed to, and for that reason it can be particularly virulent.
Let me ask you this question, especially when you're involved in emergency medicine. You're there in the emergency room at a major hospital in the region every day.
Right.
What type of fear and hysteria are you seeing? Are people coming in thinking they have it? Or are you seeing possible cases of it? Do we know exactly it is swine flu, where a lot of people are concerned right now, where some folk don't really know what type of flu they have?
It's a thin line between information and hype, and I think probably one of the worst things in the world is 24-hour news broadcast, where people get just all bombarded with all kinds of information. Some of it factual, some of it actual, and but a lot of it just unsubstantiated rumors. So what we're seeing is that somebody who has a febrile illness, and these are sort of the typical things that you get with flu. Your febrile illnesses, maybe some congestion, a runny nose, chills and fever, and the myalgias, the body aches associated with. So everybody has watched CNN or the Fox News, and they know about people, the school teacher who died in New York, and the little girl who died in Calcutta, and people are justifiably concerned. But we think that the biggest problem is that people just don't have good information about what actually is going on. And the number of cases that are existent in Mobile and in Alabama are really kind of vague. We're not quite sure at this point whether we're dealing with the seasonal flu, whether we're dealing with swine flu, or even if it makes a difference.
So a lot of the information being reported right now is still preliminary as far as being overly concerned that this is an outbreak of swine flu, because every day we're hearing about how many kids are being kept out of school, how many came down with something in school, wearing the mask in school, but we don't know yet exactly that is a case of swine flu.
Yeah, we don't really know the incidence or the prevalence of this disease, and we're really not doing a real good job in tracking it, because we're really not testing for swine flu. there's a general survey that's done to determine whether it's type A or type B flu. And if it's type A flu, then the inference is made that it probably is swine flu, but we don't know for sure. And this is not, I mean, obviously the flu kills people there, and Dr. Mike probably has better statistics than I do, but the flu kills, 30,000 people a year in the United States. And this flu is no different from the regular flu. It's just that it's been hyped up. And we're seeing that probably 50% adults, 50% children, and almost nobody that we know, nobody in the immediate vicinity or in the state, has died from swine flu. There have been some cases where it's been suspected that swine flu may have had some causation, but it's really not that concrete. And you're also seeing that, unlike with the seasonal flu, that people, and I've spoken to Dr. Mike and McKenday about it earlier, is that we're seeing that very few people over the age of 64 are dying from the swine flu or even this seasonal flu, which may mean that there is some immunity that has been conferred from previous exposures in 1977 or 1982, last time we had a pandemic.
We're going to take a quick break, and when we come back, we're going to talk to both Dr. Bucknell and McKenday Gabolahan, because one of the things, this whole fear aspect and knowing what to do, there are a lot of parents that are concerned about, oh my goodness, if I send my child to school, will they come back home? And so besides some of just the basics of hygiene, we want to talk today about some of the things that parents can do to strengthen their child in the ways that can hopefully protect them from this concern and fear right now. You're watching Speak Up. Today we're talking about swine flu. 3 health professionals tell us some of the ways that we can deal with the fear and concern about it here in our area along the Gulf Coast. More in just a moment. Today on Speak Up, we're talking about the swine flu, 3 words that brings a lot of fear and concern among parents and really anyone who's living today in the United States and abroad, because it is definitely an international epidemic that we're concerned about. Dr. Bucknell, these numbers and the concerns that a lot of people have and the fears, how real are they in your opinion?
Well, I love this because I just pulled the stats actually this morning before the taping of this. Here's the reality of what's going on. According to the World Health Organization stats for August 13th, there's been 182,000 total cases reported worldwide for the swine flu. Okay.
No, it's swine flu.
And well, that's what they say. They say it's swine flu. 182,000 cases. Okay. Of those, 1,799 deaths. Okay, now you look at just like Dr. Stone was saying, the stats, and I've seen at least 18,000 people a year are dying from the regular flu. Yet we've got 1/10 of that, and all of a sudden we're screaming global pandemic. What about you see 1 or 2 faces on TV of, some person that's died from the swine flu, and it starts all this hype. Where's the other 18,000 faces from the regular flu? And what about diphtheria and pertussis and all the other, disease that are out there? It's just, there's so much buzz behind it.
Is it media driven, or is it some health officials who are not understanding how they interview?
I think it's a combination, because it's what you've got the situation down to. Yeah, the media is big into pushing the messages out there, and it's buzzwords and keywords and all that stuff, but at the end of the day, you've got these giant drug companies who are getting massive amounts, billions of dollars of government money in order to pay for vaccinations, which in the Washington Post, they've actually exposed now that it's going to contain thimerosal. that the multi-vials are actually going to have thimerosal, which is mercury.
Okay, that's one of the concerns that a lot of parents have already as relates to autism.
Yeah, and apparently nurses have a problem with it too, because over in the UK they did a survey and found that 1 in 3 nurses has already said that they're going to refuse a vaccine. And the New York State Nurses Association has also come out and said that they feel that this is a scorched earth policy, that literally they're going to be forced to take a vaccine because they're a healthcare worker.
That's right.
But
you all
really,
are dealing with people on a close and personal basis.
Exactly, and what it comes down to, it's less than 1% of people have even died according to their statistics. Yet you look over you look at the breakdown of the statistics. There's been 1579 deaths apparently in the United States, but out of 32,000 sick in the United Kingdom, 53 deaths. Yet they're talking mass vaccination. Even Greece has agreed that they're going to mass vaccinate the entire country. So 12 million people.
Concern. Well, let's ask Makinde Gabolahan. One of the things that we're being bombarded with now in preparation for a pending vaccine coming is the whole issue of how do we protect ourselves. And the major thing that, of course, healthcare providers are telling us is good hygiene, washing hands, covering your mouth when you sneeze, turning away, using your armpit to sneeze, and these kind of things. Is that the only protection we have as relates to being protected from the swine flu, or really any flu? Because it's not, as based on these numbers that both Dr. Bucknell and Dr. Stone are sharing, it's not quite the pandemic that we're being led to believe.
Well, I believe that clearly those methods that they are talking about, that they're informing the public that they need to wash their hands and sneezing, I think all of those are positive. But I think the number one thing that people have to do is to strengthen their immune system. I mean, that's the best method of dealing with this particular problem.
Break that down into common language for the average person, because they, in many cases, don't know. Number one, I have a system that's what? Immune?
Yeah.
And then, how do I strengthen that?
Well, the immune system basically fights pathogens and bacteria and viruses, even tumors and cancers and a whole bunch of things that might evade the body. So it is the first line of defense for the body. And so, people who clearly put their hands in their mouths and their nose and their eyes would be breaching some barriers that the immune system have to fight. But the immune system is so good at what it does. If you provide the immune system what it needs to protect you, the standard American diet, I think, is sad. Right. Because it doesn't strengthen the immune system at all.
So would you say that most Americans then don't have a strong immune system? That's why we're seeing the prevalence of vaccines and other things that are being done to, quote, protect us or help us survive possible issues?
Yeah, historically, in each generation, immune system become weaker. I mean, genetically, it's a study that's been done that clearly show that African Americans and other minorities have more problems with different kinds of pathogens and viruses than the normal population, because historically the diets. And so not getting sufficient rest, stress, all of those that weaken the immune system, alcohol, people who are managing chronic diseases, diabetes. Breastfed babies do real well when mothers breastfeed their babies. They strengthen their immune system. A lot of problems associated with people not eating or having sufficient minerals and vitamins in the food, processed food, fast foods, junk foods. All of those are not strengthened into the immune system.
And when you say stress in this day and time with the state of the economy, unemployment, foreclosures on homes, I mean, folk are under a lot of stress. In your practice, are you seeing people also concerned about the swine flu? Are they coming in and asking you questions about what do I do? Should I be scared?
I've had a few people that have contacted me, but mainly it's not about them. It's more on the level of concern of, hey, we had a kid that was diagnosed with the swine flu, in the school, and so now, it's kind of interesting because all the kids are acting like the kid has AIDS now, or that it's some serious thing that nobody wants to talk to him anymore, and I just that just flat out is wrong. But I mean, what people really need to consider is that, with all the things that we've had in human history, we're still here. It's just, if our immune system was not capable, we would not still be here, plain and simple. So we got to look at what's actually, what builds the immune system, and it's what controls the immune system. Are we looking at the nervous system? Are we looking at toxicity, the amount of drugs that people are putting into their bodies, on top of the foods, and are people exercising? All these different things that are absolutely critical to keep the body functioning, those are the very things that we're ignoring. So of course we've got to worry about swine flu.
Well, I think a lot of people are concerned about, they don't want to be in that 1%, of the ones who have checked out of here. But Dr. Stone, in what you're seeing right now in the emergency room, would you also say that Americans' overall health and immune function has decreased over the years of your practice?
Well, it's hard to know, and it's not an emergency room perspective per se. I'm family practice trained, and I dealt with those things for a lot of years before I got to this stage in my life. And interestingly enough, Kennedy, I think we all can agree that the approach that traditional medicine takes is number one to try to corral somehow the pathogen, the agent that's causing this disease. And whether that agent, if you got somebody who's got a febrile illness, you're really not sure whether it's a virus or whether it's a germ, bacteria. So if you can determine that, then you give them either an antiviral agent or an antibacterial agent, and an antibiotic. And it's what Dr. Mike has alluded to. The pharmaceutical companies will get well during this flu season with Tamiflu and the Relenza and the other antiviral drugs, and the antibiotic makers will get well too. So that's one approach to it. Traditionally, you try to corral the offending agent. The second thing is that you try somehow, and traditional medicine really doesn't do much in that regard. You try somehow, the immune system, that's and Dr. Mike talks about the body's integrity, is that if you allow the body to do what the body does best, free of interference, free of toxicity, it'll take care of business, take care of it.
Hold on that point right there. We're going to take a break, and when we come back, we're going to talk about some of the things that we can do to boost that immune system, provide the body what it needs to do its job. Speak Up continues in just a moment. Don't go away. Some very vital information that will help you fight those fears and concerns during this particular possible pandemic, as well as others to come. We'll be right back. Welcome back to Speak Up. Today we're talking about the swine flu and how to overcome the fears and concern through some of the things that the body itself provides. Dr. Mike, when we look at what's going on right now, we're waiting, some people are, for this vaccine to come out and prepare for getting that as a part of taking the precaution of dealing with swine flu. How do you address that?
Well, you have to look at physiology, and that's a problem. Most people don't understand just basic physiology of the body. There's two things that are important when you're talking about immunity. Number one, proteins, basically how you're built, and number two, signals. So you've got to deal with both of those issues. Proteins, what you eat, what you put into your body, the drugs that you're putting into your body, all that kind of stuff, you are what you put in. But number two, the thing that nobody seems to be looking at is signals, how your body is actually working and how the nerve system is controlling the body. that can be blocked physically through means of the spine or other injury. That's where chiropractic comes in. That it can be mental or what you call the spiritual and emotional impacts. It can be energetic. I mean, there's all kinds of different energy possibilities there that nobody seems to look at. But bottom line, it always comes down to those two things: how the body's built and the signals that the body processes under. The difference between a dead body and a living body: dead body doesn't have signals, plain and simple.
You were comparing, before we went to break, the family practice versus the emergency room practice. And does the average American have any clue to what he or she needs to be doing today to provide the best defense mechanisms to deal with all these different things that we are being told about through the media today? I can just see people just up in arms every time a new pandemic or a possible pandemic comes out. They're just jumping all around the place trying to figure out, what do I do? What do I do?
I think so. There's a lot of educational information that's available to us. The same news media that hypes these conditions also provides a lot of information, and there's a lot of information that's available on the World Wide Web. So I think that the resources are available, and most people know that those resources are available. And if I had to give any kind of takeaway message from this, I think we've talked about the fact that this pandemic, this epidemic, might not be as bad as you think it is. And again, you don't want to be that statistic. You don't want to be the one who does die from this. So if you're confronted with the H1N1, either vicariously or in person, if your child is going to a school where there are lots of cases, you've got to enforce hygiene. And we talk about washing your hands long enough to sing a verse of Old MacDonald. Mm-hmm. That's a vehicle. That's a vehicle. Mm-hmm. That's right. That gel, the hand sanitizers, you need to carry a bottle of that in your pocket. You need to cover when you cough. You need to avoid crowds as best you can, and you need to educate yourself about what it is you need to eat. You need to eat as much nourishing food as you can, and it needs to be not processed food. And they don't have good food that I won't name names at these fast food restaurants.
Well, on that point, McKinday, talk to us very briefly about some of those things that we can do as relates to incorporating into our daily meal, because you were saying that there are certain things that the body needs to have every day.
Well, yes, I think people need to eat more of organic foods. They clearly need to focus on, if they are very concerned about their immune system, vitamin A, vitamin E, and vitamin C, echinacea, patiaca, all of those herbs, probiotics are very, very healthy. They are natural. Those people who are taking medications, they specifically have to try to build their immune system, because a lot of those medications do adversely affect the immune system. I think people need to also watch the foods. I think it's a major problem, and people don't realize that handlers who handle their food could also have colds and other type flus when they're working, and that people believe that those foods are already pre-washed or washed well, and they're not.
What's the best form of vitamin? Liquid versus the tablet? What's your recommendation for folks who are really in an unhealthy state?
Well, I think liquid organic vitamins. Synthetic vitamins are just like any drug. It's made in the laboratory. It's the absorption and the digestion, the absorption of the vitamin in the system sometimes do not occur. So the liquid actually would absorb much better.
Okay. Dr. Mike, make a final point as far as your recommendations as well.
Again, it all goes back to the immune system. I mean, what we're exposed to, we're not going to be able to change so much. But I'll tell you this: a healthy body can take it. You know, why? If you take, you take most doctors and nurses. Dr. Stone, is around this stuff all the time. Got to ask the question: why doesn't he get sick? Mm-hmm. And what it comes down to every single time is it's just how healthy is the immune system. Your body is built to take care of itself. It's built to stay healthy. You know, so if you do the right things, you don't get sick. If you don't do the right things, you stay sick. It's as simple as that. You know, in essence, when you get down to it, what you're exposed to only makes you stronger when you have a healthy immune system.
Gentlemen, thank you so much for joining us today. McKinley Gabilahan, Dr. Bucknell, Dr. Stone. We also have information available for you there where you can see their websites and their information on how to contact them for more information. Be strong and be healthy during this time, and don't handle the fear. As McKinley said, there's no need to be strung out in that area. There is help and there's information. Please check out all three sources. Thanks for joining us today on Speak Up. We'll see you again very soon.